first, I want to apologize for the voice and the sneezing, which I know will take place. It's allergy weather, and I don't know about the rest of you, but if you're suffering from allergies, it's certainly been a long season. So I'll do my best not to sneeze while I make this presentation. Secondly, Dr. Burgess, I wanted to thank you so much for convening this panel. We're delighted to participate and happy to see so many people who want to participate in the discussion in the room this afternoon. I wanted to begin by laying out how our members came to this year, what we have tried to do in terms of contributing to the policy dialogue, and where we see the discussion now. As you framed your questions, it might be the appropriate way to start. First, we spent last summer on a listening tour, going around the country, talking to regular people, small businesses, individuals, labor union officials, legislators, doctors, hospitals, a range of individual citizens across the country. And we found that we were presenting them with our proposals, and they were pleased that our community had committed to doing what it took to get everyone to participate, coming to the table with specific reform proposals. But at the same time, we heard a strong message that people were looking for health security. They wanted to know they could get into the system, they could stay there, and they wouldn't be penalized, as Dr. Burgess said, for pre-existing conditions. We took all that we heard across the country, brought it back to our members, and our board and our membership committed substantial numbers of hours over last fall, wrestling with what we heard and trying to figure out how to construct recommendations. And so indeed, as this year began, we made it very clear, we as a community support reform. But our advocacy was not going to be about what everybody else could do. Our advocacy was going to be about what we in our community could do to take leadership to contribute to, in fact, the passage of reform and contribute to giving people that message that we heard they were looking for, which is getting health security and peace of mind. That was what drove us in terms of fashioning our proposals. That's the mark we wanted to hit, and we worked very, very hard to come to this year with very specific policy proposals. We started the year that way. Now, 10 months into the year, we are in exactly the same place. We're strongly supportive of reform, and we've come with a message that our members can contribute substantially to making that happen. It's not usual in Washington that stakeholder communities actually give speeches and talk about how their communities can contribute. We've gone through that exercise. Our members work very hard, and they're proud of actually coming to the table with recommendations. So our recommendations are very specifically: guarantee issue, everybody gets in. 2, no pre-existing condition limitations or exclusions. 3, no gender differentiation. 4, no health status rating. And the idea here is to construct a system where people have the kind of access they want, portability that they want, but also we work very hard to see what had happened in states that have actually tried to do all or part of these features of market reform. And you telegraphed that very nicely in your opening comments. And what we found in the states where they went forward with market reforms and they didn't have everyone in, what we found was that the people who stayed in the system were the people who were the sickest, who had nowhere to go. Their costs increased substantially. There was rate shock, and there were strong incentives for the young and the healthy to leave the pool. And so what we've worked very hard to do is to assemble all this information so members of Congress could have the benefit of the body of information of what happened at the state level, how not to repeat this experience, and construct a system that, in fact, will create those goals that I think all Americans want. In that connection, we've talked about the pairing of a requirement that everyone participate with the market reforms because of the state experience. We saw when states went at and tried to construct market reforms but didn't have everyone participate, you have a free rider issue which is quite considerable. So the people who had no choice, who needed healthcare coverage, knew they needed it, and couldn't leave the pool, they found that their rates went up significantly. And indeed, that's what the actuarial analysis shows as you look at various proposals that don't have everyone participating. We think that in addition to the state experience, the second factor here to look at is the fairness question. Fairness in terms of as individuals approach this challenge of bringing everyone into a pool, to what extent should people who have no choice but be in the pool subsidize folks that decide to wait until they absolutely need coverage to get in? That's a societal question, it's a fairness question. I know we're going to be talking about it, and it's a very important question. The third issue is the budgetary imperative. To the extent that you construct a system, or one constructs a system, that doesn't have everyone in, it means that subsidies that are being constructed and provided to give people a helping hand, which are so important as part of this making health reform work, it means that they need to be that much higher. So all of these interactions work together in a way that we can look at what happened at the state level, we can predict what will happen if we don't have everyone participate. We know that the American people are telegraphing very strongly that they want to have a system where they can be in, stay in, and know they have portability no matter what happens to them, whether they're in the job market, whether they're moving from small business to large business or vice versa, or they're moving from public programs to private sector coverage. And so that explains why we have proposed what we've proposed based on all these different factors. We've given considerable thought to the issue of how do you solve some of the issues that have been identified, particularly in the context of discussion over the last 3 weeks with respect to how do you handle penalties, what's the right level, what makes sense. And I think, I know that my time is expiring here, so I don't want to speak too long because my colleagues will have very important opening remarks to make. But I'm anticipating in the question and answer session we'll get into that, and we're definitely prepared to talk about that with some real alternatives and very specific ideas. So the concept for us is, one, we've taken it very seriously. The issue of, is there a social responsibility for an industry involved in a particular sector? And in our sector, our industry, the health plan community, answered that question affirmatively. We thought we had a responsibility to contribute. We're comfortable. We have proposed a massive overhaul in how our market works. We have proposed something Dr. Burgess has talked to me about over a number of years, administrative simplification, to give doctors and hospitals more time to spend with patients. We can talk about that if there's time, but we are committed to reform. We remain committed to reform, and we're going to continue to work very, very hard to actually make sure that our citizens can have, the kind of access that I think they expect in this debate. Thank you.